When it comes to improving your sleep, it can be hard to know where to start.
It absolutely can. That's why in today's Eye on Health, we're going to be highlighting some of the healthy sleep habits that you can take on to sleep better. And joining us in studio is Dr. Veronica Sesi. She is a board certified doctor in neurology and sleep medicine. Thank you for being here.
Yeah, thank you for having me.
So this is a very important topic, and when it comes to sleep, a lot of times people do have issues getting a restful night. How much do you need, and also why is this so important?
So sleep is so important. It should be a natural homeostatic process, but unfortunately so many people suffer. About a third of people can suffer with sleep disorders. And the importance of sleep is that it's restorative, it's refreshing, it basically helps us clear our mind at night, and it's an essential function for not just proper rest, but proper cognition. So we see poor sleep or lack of sleep is linked with cognitive disorders, increased risk of dementia. We can see short-term issues like people can struggle with attention, concentration, focus. We can certainly see psychiatric issues, increased anxiety, increased depression. We can also see other medical conditions. It is linked with difficulty with weight loss. It is linked with cardiac disease, pulmonary disease. So sleep is really essential to help us function and be our best and feel our best.
If you have difficulty falling asleep, what are some things that you can do?
So the first and foremost, you want to identify what the issue is. So typically a lot of it can be habit related. So we're always on the go. Life doesn't end. We have access to electronics and everything 24/7. So you really want to look at, is it habit related? Are there medical conditions that are driving it? So there are a lot of metabolic disorders, different medical conditions that can interfere with our sleep, urologic issues. Do you have an underlying sleep issue? Like obstructive sleep apnea is very common reason why people wake up and cannot fall back asleep. Restless legs, narcolepsy, primary insomnia, and then habits. So all of these things can really lead to a poor night's rest. So in order to help, you want to do a holistic approach, see what is specific to that person that is causing it. As far as habits, it's very common for people to shortchange the amount that they get. And I know you had asked about how much people need. Adults typically 8, minimum of 7 is what we're looking at. Every study recommends that. Younger age group, it just depends on the age, but most school-age kids, early kids, 8 to 13 hours really. And important to keep a consistent schedule. So when we talk about our sleep, you want to make sure you are going to bed, waking up at the same time. And you want to really make sure that your habits are conducive to you sleeping. What is your bedroom setup? Is it comfortable? Is the temperature where it should be? Typically 66, 67 degrees is what we recommend. Are you again avoiding electronics? So one of the most potent regulators of sleep and wakefulness is light. And so when we have that light exposure, whether it's blue light from a screen or your phone or natural light, it shuts down the production of an important hormone called melatonin. So that is our sleep regulator. So you also want to look at what you consume. So I always tell my patients, our sleep at night is really contingent on what did you do all day? How active were you? Did you increase your drive to sleep by being active? Did you consume too much caffeine too late? Because it stays in our system. It has anywhere from 3 to 10 hours that it can stay in our system. Alcohol consumption, so it can disrupt our sleep in different ways. Also, are you consuming too much or too close to bedtime?
You talked about melatonin though, so
Yes,
if I can just interrupt you for a second.
For
Is
sure.
there dangers for people who are consistently taking that or over-the-counter sleep aids to get that restful night?
There's no magic pill, right? So again, you really want to see, why do you need it nightly? What can we do and modify or address to decrease that need for it? It is a natural hormone, so taken at the right dose, typically there are not a lot of safety issues unless you have underlying health problems. So you want to be cautious. And a problem with melatonin is very widely used, but not really regulated in terms of knowing exactly if the dosing is correct or the formulation is correct. So when we're talking about sleep aids, there are prescription ones too. Typically used for short periods of time. Again, this is nothing where you want to be on a sleep aid for decades, but it's more indicated for situational insomnia, short-term use as well.
Wow.
So, yeah.
Okay. Definitely important to know, and of course this is something we all need. We have to make sure that we make it normal to
When
get
was the
enough
last time
sleep.
you got 8 hours?
It's been a while.
Yeah.
Okay,
I
I
don't
was
know.
just making sure it wasn't just me.
Don't get less than 7 at least. Of course, 8 is really what's recommended, but there's a lot of studies that show when people fall below 7, they really deteriorate in terms of athletic performance, again, cognition, and just, everybody is a little more irritable, a little more moody, short-tempered with a poor night's sleep. So, a lot of times people will think, I don't need it, but then they compensate with more caffeine, or they compensate with naps, or they, don't function like they should. So, it's better to try to prioritize getting that sleep, healthy habits, as opposed to compensate during the day. And it definitely affects your performance. So we're not as efficient and effective. That half hour less that you got, you're going to make up during the day with,
Yeah, absolutely. We could talk about this for hours.
For hours,
yes. But thank you so much for
you.
joining us and giving those helpful tips.
Yes, you're welcome.
Dr. Sesi, we appreciate you.
Thank you. Thank you.